Hey, what's going on? I want to talk to you guys about obesity. And I know you're hearing about obesity all the time, right? But I want to talk to you about obesity from a different approach. A lot of times, what I've learned from my patients is that obesity is such a complicated chronic disease that is always considered a patient problem first. And the medical community has done such a disservice to people who struggle with obesity as a chronic condition that we have created a culture where it is considered something that lacks willpower, or the person doesn't try hard enough to lose weight, or you even have some medical providers who are creating auditioning processes for obesity treatment. Yes, I said auditioning process. You know why? Because when you look at the past treatments before GLP-1, you have to be a certain weight. You have to have a certain criteria to meet in order to be approved for surgical intervention, which is based on guidelines and safety protocol. However, when we talk about high blood pressure, right? We look at high blood pressure as two readings at different times that is in stage 1 or stage 2 to be considered hypertensive. With obesity, we tell the patient to make attempts to lose weight way more than 2 times to start getting treatment for it. And that's just not right. Obesity is a chronic condition that requires comprehensive care because it's multifactorial, which means that there are so many different systems in our body involved with it that you can't just piecemeal helping people with weight loss. And then the public, you guys, the patient, suffers because by the time you really need the treatment because it's gotten so bad, you have other conditions, diabetes, high blood pressure, heart disease, history of a stroke, history of a heart attack, history of. And to be honest with you, diabetes, pre-diabetes starts way before those numbers change. But we're just not looking at those biomarkers the way we should in the primary care setting or in any type of metabolic health setting. And I know a lot of times it's unpopular opinion. Why do you need certain labs? Why do you need certain labs? But with my patients, I do biomarker labs because that tells a truer story of what they're struggling with. And treating obesity as a chronic condition versus a patient for a problem takes away that fear that they're not going to get what they need if they don't have all these other modalities. Even the way that the insurance companies approve the medication, if you're not considered class obesity 1, 2, or 3, but you're just considered overweight, you need to have a chronic condition attached to that to get approved. So, we tell the world, you need to lose weight, you need to be healthy, you need to be better. We tell patients that in the world every day. But the stipulation is we cannot and we will not prescribe the treatment because your insurance company won't pay for it because you don't have 1, 2, and 3 going on. I have patients who struggle with obesity class 1, 2, and 3 or just overweight and don't have high blood pressure, don't have pre-diabetes, do not have high cholesterol, and they do not have any mood disorders. Okay? But when I check their serum insulin level, their C-peptide, which is looking at how hard their pancreas is working, I look at their ferritin level, their inflammation factors, they are off the charts, which means their body is going through an inflammatory process day in and day out. But the basic numbers that we look at don't show it. I even check, genetic risk factors to heart disease, because these are the things that most healthcare settings don't look at baseline for, number one, because it just hasn't been done when it comes to dealing with somebody who looks fairly healthy through routine lab work. However, that routine lab work, although it might look fairly healthy, if cholesterol is on a higher end of normal, then that's not normal. Okay, if your thyroid levels are on a higher end of normal, that's not normal. That means the thyroid is working overtime. It's a little sluggish. It's not doing what it needs to do. And when we're not talking about these things routinely with patients, they walk away from their visits thinking they're fine, but then they're frustrated because they don't feel good. And a lot of times we are not doing our part. We are sending them back to the world with figuring it out. And it could not be a part of that anymore. Figuring it out doesn't work. Figuring it out means that we will have almost 98% of people in this world struggling with obesity as a chronic condition within the next 5 years. And that doesn't mean that everybody has to be a certain size when it comes to pounds, but your body composition, the way that you feel, the way that your physical activity shows up, the way that you're able to sleep at night, all that makes a difference if you are internally not doing well, if your body chemistry is not doing well, because your body keeps the score. Sometimes you have aches and pains that don't show up on imaging, right? So your imaging, your x-ray, you're fine. You get an MRI, you're fine. Well, why am I feeling like this? Because you're having joint pain from the inflammation and the extra pounds and things like that that's on your body. I teach a lot of my patients not to even look at the scale in the beginning of the weight management system. We want to look at how you feel. How you feel determines if these are improving or not. And that's in month 1. I had a patient who she's like, I don't see the pounds right away, but I feel better. I'm able to walk in the mall with my children without getting short of breath. I'm able to go do a whole session in the gym and not feel like I want to give up after 2 minutes. Those are signs to say that you're becoming insulin sensitive. You're actually becoming healthier inside out. And then your body composition change. So even if you don't see pounds lost, inches off your waist means that you are reducing that bad fat in the body. And you are improving your lean muscle, which muscle contraction continuously helps to burn sugar. And that continuous burn of sugar reduces that inflammation. So it's all a process that you go through in order to get to healthy. And it starts with knowing where you stand and not just auditioning for a GLP-1. And I hate the fact that in healthcare, it is a process almost to make patients audition for that. I don't start with that story. I don't think it's fair. I've had a lot of patients who have tried the diets, restrictive diets, keto diets, intermittent fasting. Well, why are you intermittent fasting when you don't know what your real numbers are? Sometimes intermittent fasting makes things worse, not better, especially if you're not metabolically healthy, right? So you're going to make your body work a little bit harder. You're going to release hormones that your body is in danger and it works against you. So we make patients by telling them, you figure out how to be better and change your behaviors on your own and then come back to me if it don't work. Well, some patients don't even know what their behaviors are that's creating a pattern for them to go from this size to this size to this size to this size. And I don't like the fact that a lot of weight management programs are restrictive based on insurance in a sense where we want to decide, okay, if we start people on GLP-1 for weight management and for metabolic health, what is our de-prescribing protocol? Why are we talking about de-prescribing at the beginning? When you put people on blood pressure medication, when people are on cholesterol medication, we never start with how can we get you off of this medication for you to be healthy. We start with let's stabilize you. And let's make sure, especially if it's a genetic risk factor to heart disease, you never see people as prescribers say, how can we take you off the medication? The reason why a lot of patients come to me and say, well, how long do I have to be on a GLP-1? It's because you've been conditioned to think like that. But your whole life you've struggled with weight, or this mid part of life you're struggling with weight, there's some things there with behavior, with exercise, with nutrition that has to be modified first. And it's not a quick fix. It's not a 8-month, 6-month, year thing. Sometimes it's ongoing. Sometimes you may not need to have it every week over the next year because you've lost enough weight to become metabolically healthy, but you may need maintenance therapy. What's wrong with that? Why is that such a stigma? Why are we making weight loss medication stigma? Why are we shaming people for needing that? You don't shame people for needing to have surgery on their heart because they have a heart condition. So why are we shaming people if they need bariatric help, if they need GLP-1 help? Why is this such a thing? And you wouldn't have compound companies exist if the cost of the medication was affordable for the average person. So all that to say, obesity is a chronic condition that requires comprehensive treatment routinely, and it is not the patient's problem. We are here to serve patients, to treat patients for chronic conditions and help them to integratively live a healthy lifestyle where they can just start supplementing